My name is Bonnie Burke, and I work for Workforce Resource. Today's presentation is called Certified Nursing Assistant. It is a part of our Career Services webinar series. If you attend 5 of our webinars, you will receive a certificate of completion from Workforce Resource. I hope that by attending this presentation, you will be familiar with the responsibilities of a certified nursing assistant. Hopefully, you will also be familiar with the training requirements and also some financial resources that may be available to you. I want you also to be familiar with the occupational outlook. At the job centers, we have seen many job openings for certified nursing assistants, and we'll talk about that later on in today's presentation. I also want to talk about how being a certified nursing assistant can be a stepping stone for other medical occupations, such as a registered nurse. So we'll talk about that also today. I'd like to share with you this quote that I found when I was doing research for this class. And the quote is from Ralph Emerson. Mr. Emerson said, "To know even one life has breathed easier because you have lived, that is to have succeeded." Wow. I can so relate that to being a certified nursing assistant. I also found this video that I want to share with you. It's just a couple of minutes long, and it is actually recorded in a nursing home setting. But what I want you to notice is not just the smiles on the residents' faces. I also want you to notice the smiles on the nurses and the nurses' assistants' faces. I hope that this video will encourage you to think about this as a possible career. So you might think, so where does a nursing assistant work? Well, we all know that they work oftentimes in nursing homes. But in today's world, a nursing assistant can work in so many other facilities. A nursing assistant can work in a hospital, in home health agencies. They can work in a hospice setting. They can be trained to go into a facility, such as a hospice facility, and work with a patient who is dying. And they would work with their families and to help create the most valuable and most peaceful days, those final days of someone's life. They also can work in assisted living facilities, homes for developmentally disabled. When my oldest son was in college, he actually worked for Lutheran Social Services, and he worked in a home for developmentally disabled adult men. I believe it's probably one of the most rewarding jobs that he has ever had. He's 40 years old and he still talks about that, his days with those adult men. And then the last place I want to mention is community-based residential facilities. Sometimes they're referred to as a CBRF. The community-based residential facilities is for people who need some assistance, but nowhere near the assistance that's required in a nursing home. So as you can see from this list alone, there are several places where a certified nursing assistant can work. So what should a nursing assistant be able to do? Well, I truly believe one of the first things that they should be able to do is to display a caring and positive attitude toward ill patients. The attitude, to me, will be so important. If you're having a day at home that's really bad, car doesn't start, kids are making you crazy, but when you get to work, especially as a CNA, that has to stay at the door because your attitude is going to make such a difference in your patients' lives. A CNA should also be able to be flexible. Sometimes you'll have to work day shift, sometimes you'll have to work evenings, sometimes you'll have to work on holidays and weekends. But a CNA should also be empathetic, and notice I didn't say sympathetic. Put yourself in their position and give them the respect from their years of life and all of the knowledge that they have. And then also to be non-judgmental. The other point that I want to mention is also, and this is really important, a CNA should be someone who is emotionally stable. A CNA will have some very emotionally sad days. Some of your residents may die. And to be able to handle that in a professional manner, yet to also be able to grieve will be important. A CNA needs to be able to adjust to a diverse personalities and working with patients with all different backgrounds. My mother-in-law is currently in a nursing home, and last year, one of the residents there was actually a veterinarian from the local community. Another person was a teacher from the local community. And for them to be able to share with you their backgrounds, and yet both of those patients were diagnosed with dementia and early onset Alzheimer's. So their personalities weren't always pleasant and sharing and smiling. Some days their personalities were very, very challenging. A CNA should also be able to work under stress. From my experience in speaking with CNAs, they oftentimes have to work with 9 and sometimes up to 15 different patients themselves, getting them up, getting them dressed, getting them down for their meals, getting them back for their baths, getting them to their activities. It can be a lot of work. A CNA should also be able to assist residents with the activities of daily living. And I just mentioned those a little bit earlier, but some of the other activities will be bathing, helping them get into the bath, helping them bathe and get dressed again. Some of their other activities will be, you may need to help them with their meals, helping feed them, because some of them may not be able to actually handle a spoon or a fork any longer. The last thing a CNA should be able to do is to communicate clearly, both written and oral communication. That communication will be very, very important when you are speaking with family members, when other nurses come on staff and giving that shift turnover, and then also to the patients themselves. So you might be thinking, is nursing assistant a career for me? Well, before you invest the time and the money, one of the tools that I have created is a questionnaire, and it is titled Nursing Assistant Interview Questionnaire. So I'm going to bring that up now on my screen, and you can follow along with me, because in this handout, I am hoping that you will be able to look at some really important questions. So this is an option for you to fill out, but some programs at Workforce Resource, it actually might be a requirement. And one of the questions it's going to tell you is that the average program is 120 hours of training. Well, that's not really that long. However, during that 120 hours, you are not allowed to miss any time. 0. So, do you have reliable transportation? If you need childcare, is it covered? Do you have a backup plan? Do you have time for your other family responsibilities? Are you prepared for home and work demands? During those 120 hours, you will have a lot of homework. You will have a lot of reading that has to be done outside the classroom. And then also your financial obligations during that time that is an unpaid training. So really do some serious soul searching, look at those categories, and also talk with family members or someone at Workforce Resource if you need assistance in any of those areas. So the rest of this worksheet, as you see, there are several different questions about being a nursing assistant. And I really encourage you after today's training to take this handout home with you. Take some time when your life is quiet and when you are alone and really do some serious soul searching and to answer some of these questions. You know, for an example, why do you want to become a nursing assistant? If you can't answer that, or if your answer is because there's a lot of job openings, may not be a good fit. What hourly pay will you need to make? And how many hours per week do you want to work? Well, as we all know, there is a high demand right now for nursing assistants. And with that demand, the hourly raise has increased. So if making a substantial hourly wage is important to you and your family, make sure that you check with the facility before going through the training, what exactly is the average wage? And we're going to talk about that a little bit more in our training today. So there's 8 questions that you ask yourself. The other piece of this handout is actually a questionnaire that I'm going to encourage you to do with another CNA. So what do you mean, another CNA? This can be somebody who's retired. I want you to get together with somebody who's been a nursing assistant, the kind of been there, done that, so to speak. Because initially I thought, how would I know for sure if I wanted to be a nursing assistant? When I was putting together the material for this class, I did call several nursing homes and I'd asked if some of our clients could tour or shadow another nursing assistant. And because of liability, I was not able to arrange that. So hopefully this questionnaire will be the next best thing. Because with these questions, you will be able to hear from another nursing assistant what was her day like? What was the best part of being a nursing assistant? My youngest daughter was a nursing assistant for several years, and I asked her those 2 questions. So I said, hey, what was the best part? And she said, absolutely the residents. She said every day they would greet you with a smile. Even on their bad days, she could get them to smile. And so then my second question, and this is what I want you to ask a CNA, my second question is, what was the most difficult part of being a nursing assistant? And she said 2 things. The first, of course, was when one of her patients would die. But then the second piece was the very long hours. Physically, it was really hard, and yet, so she knew that going into it, and she was preparing herself. She would run, she was doing sit-ups, she knew that she was gonna have to be on her feet for 8 to 10 hours a day, and she physically did get prepared, but it was hard. So with the rest of the questions that are on this list, read over, there's 9 of them. If you do not know anyone who is a nursing assistant, I encourage you to talk with them at the job center. We may be able to help find someone that will interview with you. So 2 worksheets that I think will help you answer the question is certified nursing assistant a field for me? Is it going to be a good fit for me? So those interview questions, jot them down. The other piece that I wanted to share with you today are the job postings. Oh my goodness, there are so many job postings for certified nursing assistants. In Northwest Wisconsin, and so that's Eau Claire, Chippewa, Barron, Dunn, Polk counties, the median or the average starting wage is $12.05 an hour. Granted, there's places that pay much higher and there are places that pay lower. The national average, however, is a little bit lower, so good job, Wisconsin. The national average is about 1196. So I like to use two different websites when I am doing job searching and helping people look for jobs. Well, the job posting website that I want you to take a look at is Indeed.com. On Indeed.com, I just did Rice Lake as where I wanted to search. For what? I put in CNA and make sure that you add the period, C period, N period, A period, or it may not come up. And look at all of these job openings. So lots and lots of job openings. Remember, I just did the search for Rice Lake. So after today's class, I really encourage you to go to Indeed.com or the Job Center of Wisconsin and do a search for the area that you will work in or the area that maybe you may relocate in, and do a search and see for yourself all of the job openings that are available. You might want to think, so what are some of the requirements? So what do I need to have in place in order to work as a CNA? Well, the first thing, when you enroll in school, every school and also every medical facility by law has to do a caregiver background check. Now, it might seem like, really? But it is the law. So there's nothing you can do about that. The one thing that I always encourage you is when they ask for your information to do the background check is to be honest. Oftentimes, a person may have done something really silly when they're 17 or 18 years old, and now, for an example, if they're 28, well, that was 10 years ago. I was a kid. That's not on my records anymore, right? Wrong. It stays there forever. And if you think something has been expunged, write that down as well. Once you have given them the information about the background check, and if you're interested in getting additional information, like what are they looking for? Why is this a requirement? Go to this website. It is the Department of Health Services, the state of Wisconsin.gov. And you'll have a little bit better understanding of the law that does require the schools and healthcare facilities to do a background check. I really like this website because it goes into complete detail on what forms do they use, what's the process, what does it cost, what are the rules and regulations. So it's a great website if you think, I'm not sure, maybe there might be something out there when I was younger. So once again, be honest and go to this website for additional information. The other requirements, like I said earlier, is the training. Only 120 hours. Really not bad at all. But once again, keep in mind, you have to attend all 120 hours. So look at this, however. The 120 hours, only 88 hours are in a classroom. So some of you might think, oh, I can't sit that long. That is a long time. However, you will have 32 hours of hands-on training, and it's called your clinicals, where you will actually get to work in a nursing home or an assisted care facility. That clinical practice, I have heard, is so much fun and so rewarding. You will get an opportunity to apply all the information that you just learned in that classroom. You will learn everything from nutrition, nursing care procedures, body functions, and you will also get to learn about the legal considerations and ethical considerations of working in healthcare. One of the legal considerations that they will cover with you is called HIPAA. It's a health insurance portability clause, which means that any information that you learn about your clients has to remain confidential. Training. After you've finished the classroom and your clinicals, you next will be required to take a state exam. And it's called the Wisconsin Nursing Assistant Written and Skills Exam. Yep, that's right. You actually have to, in front of an instructor, show skills or demonstrate skills such as washing your hands. We all know how to do that, right? Well, in healthcare, there's a specific procedure. They are going to watch you take on and take off gowns and gloves. They will watch you as you use an electronic thermometer. As you record a pulse, they'll watch you even as you make a bed. Sounds pretty intimidating. And for some people, it is. Any client that I have worked with over the past few years, that the skills test has been the one area where they have stumbled. And I think mainly they know the information. It's just they're nervous having somebody watch them. And you can retake the exam. So one of the other handouts that I have for you is called the CNA Skills Exam Checklist. When you go to school, refer to the checklist they give you. However, I wanted to show you a few of the things that at this time, and remember things change, so at this time, these are the skills, the different areas that they will be checking for. I just get a really big kick when I think of hand washing. There are 14 steps to hand washing. Yikes, right? How will I remember all of them? Well, you can, and you will remember it just with practice. The donning and removing of PPE or personal protective equipment, such as your gowns and your glove. There's 21 different steps of putting on a gown and gloves. Oh my goodness. So as you can see, this is one of those areas where some students have had to retake, which is absolutely fine, because to know these skills and to be able to perform them well at your job is going to be extremely important. I wanted to show you a few places where training is available. I know initially I thought, well, you could go to Chippewa Valley Technical College, or in my area, which is in Polk and Barron County, you could go to WITC. I had no idea that so many other places also offered the training. So for an example, Dove Healthcare at their west location in Eau Claire, they offer the CNA class right on site. Their website at this time is actually referencing a tuition reimbursement program, whereas if you take the training through them, you pay for it up front, and if you work for them a specific period of time, they will reimburse you the cost of your training. Pretty good deal, right? So this is some of the requirements for Dove Healthcare. And remember, some of the requirements are a little bit different. For an example, at Dove, the applicants have to be at least 18 years old. However, at WITC, at the technical colleges, the applicants they have to be at least 16 years old. So making sure that you have a complete understanding of what are the requirements for the facility that you're going to be attending your training. The class size is limited here at Dove, and I think personally that would be wonderful. Only 8 students? With 8 students, you would get so much hands-on personal training, one-on-one. When I read that, I was like, wow, that would be important for me when I'm learning something new. So the other requirement is that you have to own scrubs. And if that is a financial burden for you, and if you're working with someone at Workforce Resource, we may actually be able to help you pay for scrubs. You must have a watch with a second hand. In today's world, who owns a watch, right? We all have our cell phones. We don't need watches anymore. But to be a CNA and take this class, you do need one. And the administration reserves the right to remove any student due to misconduct of any kind. So keep that in mind as well. It's very serious. So training options at WITC. I wanted to share with you their cost. It's not a lot of money, but yet it's not a little. So just the cost of tuition there, and remember this is current, and these costs do change. So currently the cost is $431 plus your books and supplies, which is an additional $160. At WITC, students have to take a reading test before they can be enrolled, and WITC also wants you to be very knowledgeable of basic anatomy. So they will send home books with you so that you can read and learn even before the school has started. So remember I said at WITC, you only need to be 16 years old. The test that I just referenced is called your Reading Entrance Assessment. And once again, just like any other training facility, you do need to pass a Wisconsin Caregivers background check. and that there is a fee to have that background check done, so you'll have to pay for the fee ahead of time. And WITC has a mandatory orientation session. The first time I heard about that, I was like, great, because a lot of students have not attended school for years, and for now, even to go back to a short program such as this, the ability to know what's coming, what books do I have to read, what do I need to be prepared to be successful, those are all the things that they cover in their orientation. So remember, that is a mandatory session, so you will have to attend that. And you'll also have to pass a physical exam. And you will also have to have your current immunizations, so they will check all of your immunization records, and they will conduct a TB test and have you go to a physician and making sure that your TB test is negative. So Chippewa Valley Tech, I can't forget this technical college as well. So their requirements are almost the same as WITC. They have grouped their tuition and books at this time together as $519. I wanted to tell you some other places where training is available. Remember, we've talked about WITC, Dove Healthcare, and CVTC. Well, for people who live in the Eau Claire or Chippewa area, or who don't mind driving, Grace Lutheran Foundation also offers the training. On their website, you can check out their CNA program, just like all of the other programs that I have mentioned. I so encourage you after today's class to go to the different training facilities websites and spend some time reading and learning what are they looking for, what do they encourage students to do. And so with this one, they're going to bring you through step by step, what are the requirements. So a pretty good website. So that one is at Grace Lutheran here in Eau Claire. Another place is through the American Red Cross, and that one is housed in Altoona. Once again, kind of close to the Eau Claire area, and yet maybe it would be a better location for people who live south or east of Eau Claire. So the American Red Cross, their training offers at several different sites, and I encourage you to look up their website so that you can find out where their sites are at and what is their training requirements. Two more sites that I wanted to mention. Like I said, I was amazed when I found out all the other places that are offering training. In fact, when I was doing research for this class, I thought, okay, Workforce Resource, we have clients in northern Wisconsin, and we also have clients south of Eau Claire, east and west of Eau Claire. So here's the facility over in Boysville. It's called the CNA Professional Services. There's their phone number and website. Check them out. Or if you live closer to Spring Valley, at the Spring Valley Health and Rehab Center, they also offer CNA training. I actually did get to do a tour of that facility, and I taught a bloodborne pathogen class at the Spring Valley Health and Rehab Center. It is beautiful. I was just so impressed. It was, I just can't say enough good things. I had a wonderful day. And so there's their phone number and their website as well. One last place that I don't want to forget, and this is more for our northern clients, at the LCO Community College in Hayward, Wisconsin, also offers CNA training. However, the unique thing about their program is that the students who take their training may, and I have to say with a big capital M, may qualify for financial aid, such as FAFSA, because their CNA program is designed as a stepping stone. Remember I said earlier, a lot of programs, such as a registered nurse, you have to be a CNA first. And so how LCO has designed their programs, their CNA course, you may qualify for FAFSA. They ask all of their students at a minimum to complete the application to see if there's some financial assistance there for them as well. Final steps of training. The exam fee. There's more fees to come, right? So to take the test, it's about $115. Once again, that can change. The exam consists of, like I said earlier, 70 written items. That's not too bad, right? 70, I know you can do it. You have to pass both tests within 3 attempts So if you don't do well the first time, that's absolutely fine. You can retake it. However, watch the calendar, because you have to pass both tests within 3 attempts or within 1 year after completing your training. So that might make you a little nervous, but yet keep in mind they are giving you another chance, and you have up to a full year. I know that most people can get it their second attempt. After you have completed that step, you then will be added to the Wisconsin Nurse Aid Registry. This is really important because to be hired, the hospitals or the nursing homes have to verify that you are on the Wisconsin Nurses Aid Registry. The other piece is that if you think, oh, I might really need to polish some of my reading, my writing, my test-taking skills, check with people at Workforce Resource. We have so many resources available that can help you prepare just to take a test. The test that you will need to take to get your CNA, however, is not at the technical colleges or Dove Healthcare. It's actually conducted at an approved training center, and it's facilitated with an agency called a Pearson VUE. Sounds confusing, right? Well, it really isn't. But at the facility where they do your training, they will help you with a list of where are the training centers and how do you register to take your exams. So, once again, the CNA is a stepping stone. I love this about this program. Not only is it a stepping stone, it is a pre-requirement if you want to become a licensed practical nurse or an LPN. It's also a requirement, like we said earlier, if you want to become a registered nurse, and then also if you want to become a medical administrative assistant, you have to be a CNA first and to complete the training and the test. So you can look at it as a stepping stone or as a pre-requirement. If you're thinking, oh, wow, I'm not sure I can afford to take this. I don't know if I have the support I need to be successful. So my encouragement for you after today's training is please see someone from Workforce Resource. Inquire about possible support. We have several different programs. If you qualify for the programs, you may qualify for some financial support. If you currently are not enrolled in our program, I will encourage you to go to our website, which is workforceresource.org, and our application for services can be found on our website. It's under our job seekers application. So it's a little confusing, yet the resource specialists at all the job centers are there to help with that process. So if money is a barrier, please talk to someone at the job center. I always have to say may with a big capital M, but which is true because funding changes, support, monies change, and I'm hoping if you need that support that we can help you out. I have a few questions that I want to ask you before we wrap up today's training. I gave you a lot of information in just a really short period of time. What do you feel is the most important qualifications for a CNA? You might think, that's kind of a subjective question. And you're right, because what I feel may be important, you may feel is not quite as important. However, in reality, I believe it's compassion, patience, and also having a great attitude. So my second question to you is, so why is it important to complete the Workforce Resource Assessment? The assessment is the handout that I mentioned earlier, and the questionnaire. Well, the answer, I believe, is going to help you determine if being a CNA is a good career for you. Because to spend the time and the money and then realize, oh my, this is not what I thought it was. I'm not sure I can do this. So take the time up front and to complete that assessment. How long is a CNA program? That's our next question. Did you get the answer? It's 120 hours. Not too long, but keep in mind you have to attend all 120 hours. Another question, name 2 places where you can attend training. I mentioned quite a few. So I'm going to give you the answers. I'm going to give you just a few of them. CVTC, or Chippewa Valley Technical College, WITC, and if their classes are not offered in a timely manner when you want or need to attend, also check out Dove Healthcare System, CNA Professionals, and there's many, many other places, even the American Red Cross. So my last review question, name 2 places where a CNA can find employment. You can work in a hospital. You can work in a home health agency. A home health agency is where a person gets to stay in their home, yet they may need help with bathing, they may need help with meals, with food, and you'd get to actually go right into their homes to take care of them. Nursing homes, residential care facilities, the list is really quite long. So keep that in mind. Thank you so much for attending today's presentation on Certified Nursing Assistant. We have covered the career, what it will take to be a CNA. We've talked about the different places where you can attend training, possible resources that might be able to help you. I really encourage you to take those questionnaires home, go through them, find a CNA that you can interview. There are so many jobs out there right now for a CNA. This may be your next career. Thank you for attending, and have a great day.